Awesome. Well, thank you, Mary, for having me. I'm actually an FGCU alum from 2011, and I was hoping everybody was thinking, wow, I can't believe he graduated 10 years ago. He looks so young, but nobody said it. So as far as Elite DNA, we're actually a behavioral health group. So the DNA is an acronym for the owner's three kids, Dylan, Noah, and Asher. And the owner, who grew up in Fort Myers, built this clinic really out of the needs of her own children. And to kind of give you an idea of who we are, I just want to give you an idea of our footprint. So we now have 12 behavioral health locations. We treat roughly about 800 behavioral health patients per day. We have 40 psychiatric providers, 42 therapists, case managers, care coordinators. I think what makes us unique is these next 2 points. So traditionally speaking, in behavioral health, there's generally a high no-show rate, just the nature of the industry. However, we have a relatively high patient show rate, and we attribute that to the engagement of our clients, a lot of the things that we do geared towards the patient experience. But in the end, it really comes down to the quality of services that the patients get. We're very proud of the services our providers deliver. And then this is kind of a phenomenon. The average length from psychiatric referral to appointment is blocking myself here, is 1.21 days. Generally speaking, across the country, the average wait is roughly about 90 days. But access to us is extremely important. We feel like if an individual is seeking these services, that they're probably at the point where they desperately need them. And so that's why for us, getting access to clients is very important and part of our model. And then these are some other services that we offer, transcranial magnetic stimulation and substance abuse services as well. Just to kind of give you again, a footprint of where we are. These are all the counties and offices that we offer. Some of these locations, for example, Jacksonville, those offices opened in January. We have some other offices like Brooksville that opened, and Inverness that opened recently. And then these are the offices that will be opening here. We have 4 opening within the next 3 months or so. So a lot of growth. I've been with the company. I was actually the first employee hired back in 2014, January 2014. So it's been 7 years. So it's been a lot of growth. We've grown over 20% every year. And we're very proud of the growth because, we've been able to continue to serve more and more patients throughout those communities. Our model, to kind of give you an idea, was a little unique in the way that we're a for-profit, but we take all insurances, Medicaid, Medicare, and commercial. So strategically, we've done that so that referring providers know we take all ages and we take all the insurances. So it's much easier to distinguish, okay, well, I could just send all my patients to Elite DNA versus thinking, okay, well, Elite DNA only takes these insurances or they only see these ages. We want to make it very simple for our providers. So that's kind of who we are as a company and the services that we provide. As far as our culture and working at Elite DNA, there's kind of 3 pillars of employment. It's purpose, potential, and play. And so, trying not to get too into the weeds here, this is how we view, anybody who's working with us. These are the 3 most important things of employment. And I think, a lot of people, when they think of employment, they think of finances and money. But the truth is, I'm sure would be willing to work to make a lot less at a company that you really love working for. And I'm sure at some point, if you're making a ton of money working for a company that you hate, are you really going to have sustainable employment there? So purpose really is, why we do what we do. So, why do you come to work? Why do you work for a behavioral health group? What about that? And we noticed that most of our employees either have a direct impact in behavioral health or a family member does. So they may have a child with autism, or they may have a parent who has, a bipolar disorder. So they've seen that experience, they've experienced behavioral health firsthand and are passionate about helping those people, or maybe substance abuse as well. Potential. So what's your ability to grow, right? So not only people think of potential, they think of, getting into management, but that's really not what potential is. It's what is your ability to grow either as a clinician, as a professional, as a person, and how can Elite DNA help you do that? And then the ability to play. So the ability to play, think of it as, how much autonomy do you have in your job, right? If everything you did had a script, or or was very policy driven, you wouldn't really have the autonomy to create a nice experience either for yourself or for the patients. So the ability to play, the ability to have autonomy to make decisions in your role is extremely important, because it makes what you do more enjoyable. So those are three big pieces to us that we drive as far as our pillars of employment. Very briefly talking about our culture and the things that attribute to our culture. So we're very employee centered. As an administrator, my job is to take care of my providers and my employees, because I can't directly take care of patients. So we're very employee centered in that way. Professional development is extremely important to us. So we actually created our own training and professional development mechanism called Elite DNA University, where we offer trainings throughout all our departments. So we actually have 60 trainings for the first 6 months alone. And some of those trainings are 2-day trainings in which we allocate time for our employees to do those trainings. And some of those are 2-day trainings. So we get, there's different levels of courses and training just depending on what our employees have told us they want to improve. Our benefits package is kind of a typical benefits package with paid time off and paid holidays, 401k, and medical. We do have wellness initiatives, so we're very focused on you as not only as an employee but also as a person. And our wellness initiatives aren't your typical weight loss challenges, which we've done in the past, and those are very successful. But not everybody wants to lose weight. Not everybody wants to necessarily be fitter, but they want to be a better person in some way, shape, or form. Maybe they want to volunteer more. Maybe they want to be able to meditate or be more mindful. So those, we pay for things like that for our employees to improve themselves. Tuition reimbursement, and we also are a HRSA student loan forgiveness site as well. So to kind of give you an idea of current employment opportunities, and if I wrote an exhaustive list here, I'd be here forever. So I just kind of summed it up. We're always hiring OT, speech, ABA, and psychotherapy providers. Always looking for case managers, care coordinators. So care coordinators are the first clinical encounter that a patient has when they come to our site. A care coordinator is a great entry-level position for somebody who thinks they want to do something clinical down the line but aren't sure. It's a great position because they interface with all of the disciplines, and their job is to really meet with the patient, get an idea of what the patient's needs are, and then formulate a kind of a treatment plan for that patient to go forward, not only in which services that patient would benefit from, but also which providers would be the best fit based on the patient's age, the patient's diagnosis, and so on and so forth. So a great entry-level position, whether you're looking to get into behavioral health or any kind of the other specialties that we have. The Connection Center representative is a representative who works with patients on the phone to try to determine where we can get this person, this client or patient in for services. And then we're also always hiring operations managers and training. So anybody who's maybe looking to get into healthcare, not sure where they want to go, know that they want to do something maybe in management down the line. It's a great position because it interfaces not only on the operations side, but we also have you work on the administration side as well and get you experiencing different things through different departments, whether that's through the credentialing, whether that's through revenue cycle, compliance, payroll, talk about operations, business development. So it kind of gives you a little taste of everything. And then at some point you kind of specialize in specifically what your interests are. And then we always have internships for maybe students who are just trying to figure out, again, a better piece of what they want to do, what they don't want to do. Internships are always very valuable in that way. The application process for Elite DNA, you could always apply through our website, and we have resources on there in which you can apply, or Indeed.com for specific positions. What I was always recommend, and what I would, to even tell a family member of mine, is if you really want to get noticed, reach directly out to somebody. Myself, I put my email on there, or you can reach out to me through LinkedIn. I always love when I see someone who tries to connect with me on LinkedIn or just reaches out in a message to say, hey, I saw your presentation, or I saw your company and I didn't see a position that was necessarily one that applied to me, but would love to talk about my skill set and maybe how I can help your company. Those are things that really stand out to me, or I'm sure to any employer. But we're a small enough company at only 250 employees, where every employee that we bring in is important to our culture. And so I'm happy to spend the time, even if it's not with our agency, we spend time with anybody who reaches out and says, hey, just want to get an idea of maybe if there's a fit for me in your agency, or if you know a company that I can work for. So I'd recommend, grabbing those two, either my email or my LinkedIn, and connect. So one of the things we need to talk about here is interview skills. And it's kind of hard because every position is a little bit different, but the things that we look for uniformly across any position are these kind of 5 elements here. So to be friendly and connecting, right? So it doesn't matter if you have experience or don't have experience in a position. We're looking for a kind of a friendly face and somebody that's easy to engage with or connect with. So, you don't need to be someone who's maybe an extreme, extrovert, right? You could be an introvert, but somebody who, can have timely conversations or can really connect with the person who they're interviewing with. And that, that has a smile on their face. I think regardless of the position or the company you work for, that's always important. To be prepared and organized for your presentation. I think it's important interview, excuse me, that these are 2 different things, right? To be prepared means, you come in, with questions, you've researched the company, you have an understanding of the job description in which you've applied for, but also being organized in a way where you have all that information accessible. It's not just at the top of your head, because, I'm sure everybody gets a little bit flustered when they interview. So to have that on paper in a nice organized fashion, to have, copies of your resume is always, kind of a great thing to have, even if the company doesn't need it. It just makes you look more organized. We always, when we interview with multiple people, and we always have kind of gold standards as to individuals we've interviewed in the past, the things that they did in the interview, and then how they delivered in their job. And one individual that we always think of, had this binder of questions and resources and the job description and information on the company, and it was so well organized. She even had page dividers. And she went on, and she's been with us now for 5 years, and one of our most successful therapists, and now one of our managers. So it just goes to tell you that not every position you need to be extremely organized for, but you want to present yourself in that way when you're interviewing. Inquisitive and interested. So again, I feel like those are 2 different things. So asking good questions is important. I always think it's important to try to have 10 to 15 questions prepared for the interview, but along the interview, I'm sure some of those will have been answered. So, you may wind up only asking 5 to 10, and I think that's great. I will say that there is always an extreme level of too many questions. We had one candidate who kind of talked herself, or asked herself out of the position. She asked questions for close to an hour. Questions, some of them weren't even related to the position. So just be mindful. I think, 5 questions is great. If you have a little bit more, that's perfect. But obviously have them be related to the position themselves. And interested. I think, asking a question is important, but being actually truly interested in the answer is even more important. So I always find it interesting when someone asks a question, and as you're answering it, they're not even listening to what the answer is. They're already kind of thinking of their next question. So just kind of keep that in mind. Also very important, know your weakness or weaknesses better than your strengths. To say that, your weakness is that you're too organized, those are kind of cliches in interviewing that a good interviewer is going to look past. We really want to know, what do you know is your weakness? Either how can you, grow that weakness, or how can you, be put into a position where we can kind of work around that weakness. So it's important to kind of know and be able to speak to whatever that weakness is. Obviously, it's great to know your strengths, but knowing what you're not good at is just as important as knowing what you're good at. And then I always say, just be yourself, which is obviously the most important thing, because you don't want to fake yourself into a job, right? But also, if you're somebody who's habitually late, for that day, don't be yourself, because being organized is extremely important. Being 15 minutes early is really perfect. I've had candidates show up 45 minutes to an interview, And that to me is a little bit way beyond excessive. It makes me question why that candidate is just too early. So that's kind of what we're looking for as far as interview skills. Obviously, each position is a little bit different, but as far as a foundation, that's as far as Elite DNA, that's what we're looking for. And then question and answer. I'm happy to take any questions that you have now. At Elite DNA, there is no dumb question. It's only the question that you didn't ask. So I'd rather an employee, an interviewee, a candidate ask really good questions, or questions that maybe they just would like to have a better understanding of, than not ask the question at all. So are there any questions? I know I've kind of breezed through this a little bit, but we have plenty of time for Q&A. What questions do you have?
What types of tasks or responsibilities do interns have?
Yeah, so it's going to depend on the internship itself. So right now at Elite DNA, we have 42 interns between our 12 offices in each different department. So we have somebody interning in compliance, somebody interning in operations. We have a lot of clinical interns like social work, nurse practitioners, PAs. We have interns who are interviewing doing internships in case management. So or in care coordination. So it really depends on what you're looking for as far as the internship itself. Do you have an idea of which internship ideally you're looking for?
Not exactly. Maybe something that qualifies for an undergraduate that's still working for a bachelor's.
So are you looking for something like clinical? Do you see yourself working with patients down the line, or do you see yourself more on the back end administrative or management?
Either clinical or the back end.
Yeah, so if it's clinical, the care coordination internship is a great internship to start, because again, it gives you, we kind of train you to be able to work with clients. And so that would, it depends on what you're looking for, but traditionally speaking, 8 to 16 hours a week is something that really works well in care coordination, because it gives you the ability to kind of get yourself trained within about a month, or have us train you within a month, and then start to work with clients. And so what you do is you'll meet with clients, you'll be able to, kind of really get an idea of what their needs are, and get a feeling for if that's something you really want to do. Do you really want to work with clients and be able to help them? And I think the care coordination internship is great for that. As far as on the back end, an operations internship is probably something that would kind of give you the most bang for your buck. We talked about the operations manager in training. Well, the operations internship is kind of a scaled down version of that. We kind of pick one or two areas that you're interested in. Again, maybe it's finance, maybe it's compliance, maybe it's specifically operations, and we'll have you rotate through those two positions. Again, that could be 8 to 16 hours a week, just depending on what you're looking for. And you'll really know at the end of probably 3 to 6 months if you want to really work in the healthcare operations side or the finance side, or whatever department you choose.
Oh, okay. That sounds fun.
Hi, I have a couple questions. Do you guys hire a lot of individuals that just graduated with their bachelor's degree and don't have a graduate degree?
Yeah, we do. I mean, it depends on the department too, but I see a lot of those individuals either in our case management department. I see a lot of those individuals in our care coordination department if they're looking for clinical, and then even on the operations side as well. The key is really not so much do you have a graduate degree, it's, do you know or have an idea of what you want to do in the future, and how can Elite DNA help you train for that?
Yeah, and then I noticed you had a lot of resources for employees for educational purposes. So particular for me, I plan on going to get a PhD in clinical psych pediatrics. But until I do that, I'm looking for a job for the next couple of years. So you recommend case coordination for that, for people who want to do clinical?
Yeah, I think care coordination, especially if you're looking to do a PhD, as you just mentioned, that would be the best fit, because it really gives you that hands-on experience. And because our care coordinators work very closely with our licensed therapists, you learn a lot. I mean, it's tremendous how much you'll learn. You'll have access to all the Elite DNA courses that are not only for care coordinators, but also for therapists. So, we kind of train you and teach you like a therapist, even though you're in the care coordination department, because we want you to be as knowledgeable on, on therapy itself, because a lot of our care coordinators or have those aspirations to be a therapist. So that would be a great position for you to start in.
Okay, perfect. Thank you so much.
Hey, you're very welcome. Who else had a question?
I have a question. What would a typical day look like for the care coordinator? Like, are you with the therapist for most of the day?
Yeah, so good question. So once you're done with your training, the care coordinator will have a schedule of clients. It really just depends on how experienced they are and how comfortable they are. They may have 4 scheduled clients. They may have 6 scheduled clients or 8, just depending on the day. We don't go more than 8. And the show rate for intake, is going to vary, as it said. It's usually a 10% or 20% show rate. Usually a little higher on that first appointment as a no-show versus the other. But you'll have your clients scheduled. You have the paperwork and the chart for them, so you kind of know or have an idea of why they're coming in. You'll meet with the clients. Right now, we're doing a lot of virtual, about 85%. But there's also the ability for the patient to come in. You'll meet with them, kind of get it, spend 45 minutes to an hour doing an assessment. We have all these assessment tools and things that we do. Then what you'll do is you'll remove yourself from the room. You'll kind of present the case to a licensed therapist. And so that's when you're really working closely with them, and you'll say, okay, I have an 18-year-old male, who came in today because he's feeling anxious, this, that, and the other. And you kind of present it to the therapist, and you'll work with them together. Say, okay, well, what do you think they need? Okay, well, I think they would benefit from therapy. They're a male and they have anxiety, so this therapist would be best. So you kind of collaborate together, and then you go back in the room with the client and kind of discuss, okay, well, this is the treatment plan we're going to put together. We're going to go ahead and get Michael to get you scheduled. And then you also follow up with that patient, usually about 2 weeks after that initial appointment, just to see how their treatment's going. Because we you have a vested interest to make sure that client is, successful, right? We want to make sure that they're getting good outcomes. And so that's kind of a day. And then there's trainings throughout the week and supervision time throughout the week to be able to work with the therapist that you normally work with, or trainings through Elite DNA University. So there is documentation for each patient that you have to do. You have to write up the note, right? So everyone going forward knows why you recommended them to therapy or why you recommended them to psychiatry. But it's a lot of patient face-to-face interaction.
Wow, that sounds really cool. Like a really good way to get experience.
Yeah, and like I said a little bit earlier, it is the perfect entry-level position if you want to do something clinical but you don't know, because we have providers in that position that go on to become therapists. We have providers that go on to become nurse practitioners. Some realize, I really like occupational therapy, and then they go to OT or ABA therapy. So it just really gives you not only a clinical experience with a client, but also a better idea personally, okay, well, really, what do I want to do with my career? And we'll help you kind of navigate that.
Thank you.
Who else?
Do we sort of have a choice of where we could go for an internship?
Yeah, so we of all the offices, Southwest Florida is our biggest presence. We have 3 in Lee County. We have Collier, we have Charlotte. So yeah, we're open if you live in Charlotte County, and we have the availability to put an intern there or provider. We're happy to do it if it's in Lee County. So we normally have pretty good availability to go ahead and have you try a different, find a location closer to your house.
Okay, thank you.
Okay,
Sorry,
great.
I have one last question.
Mhm.
For someone who is interested in a position in the next couple of months, do you recommend us email a resume now prior to applying, or?
Absolutely. Yeah, I think that's a great, I don't want to speak to all companies, but just in general, a great kind of mindset to have. It's better to be a little bit, too soon and be told, hey, try back in a month or, 2 weeks, whatever it is, than to be too late, right? So if you're, down the line, whether you graduate in May or what have you, or you're just going to be looking in a few months, send it now, and let's go ahead and start the process. We may say, hey, let's wait a month, but we're normally we'd rather be ahead and know that, okay, well, we have this this individual coming on aboard in May. So make sure we allocate, you know, an office or, you know, a position in that location, then to do too late, right? And then we've already filled that position. So I would recommend reaching out to me via email or LinkedIn, send a resume, let me know, you know, where we met, whether it's through here or what have you, and what position, you know, you felt like was you were the most interested in.
Thank you.
And like I said, even if it's, you know, maybe you don't hear of something that you're interested in with Elite DNA, it's always good to network. If you felt like, you know, I'm interested in healthcare, maybe not specifically behavioral health. Do you know of anybody in the industry or anything? You know, have a question or concern. You know, I've, you know, I mentioned I've been in that position where I wasn't sure what I wanted to do and wanted to pick people's brains. I was lucky to have a lot of people who were interested in talking, and obviously landed where I landed. So I'm happy to ask, you know, to answer any questions you have, even if it's not specific to Elite DNA.
Thank you.
And for those of you who maybe, you know, again, have a question that come up after the fact or just don't want to speak up now, again, feel free to email me that whatever that question is as well. I'm happy to answer it.
That's great. Thank you, Philip. We really appreciate you being here and sharing about Elite DNA therapy. Rose, did you have any last minute
I
thoughts?
just wanted to say thank you again, Philip. I appreciate your time.
Thank you. Thanks for having me.